Sepsis is one of the top 10 leading causes of death throughout the entire world. Good news is that we're able to decrease the mortality rate by good early recognition and good early treatment. And that's where EMS comes into play using end-tidal CO2. Let's check it out. So when we talk about sepsis, we talk a lot about early recognition and early treatment. That's really where EMS comes into play. So let's talk about how all this pathology is working inside the body, so that way we can truly understand when we recognize sepsis, why it's so important that we treat it early and taking care of those patients. And so the first thing we need to talk about is lactate. So inside a sepsis patient, what's happening is that we are shifting from a perfused state and an aerobic state of actually getting oxygen, using it as energy, and changing to a more hypoperfused state as well as an anaerobic state, which means that we are starting to see less oxygen at the cells. They're being hypoperfused, which means that we need to switch to an anaerobic metabolism, which again basically is a byproduct. And that byproduct is an elevated lactate. And so this word hyperlactatemia is just simply a higher than normal lactate. Okay, and how that actually occurs is actually within the actual Krebs cycles itself. So in pre-Krebs we have pyruvate. Okay, pyruvate. And pyruvate essentially is going to try and break down in a CoA, okay, acetyl-CoA. But in order to do that, we need to actually have aerobic metabolism. And so when we can't have aerobic metabolism, pyruvate ends up trying to create energy, NADH and FADH, by basically using anaerobic metabolism. And the problem is that byproduct is lactate. Okay, so we're seeing lactate as a byproduct of hypoperfusion and hypoxia within the cells. So as we're still continuing to try and create energy through the mitochondria inside the cells, we're ultimately going to be creating a lactate. And this lactate elevation is going to precipitate to our metabolic acidosis. Okay, metabolic acidosis. And that's going to precipitate. And also another big thing when it comes to Krebs cycles and pre-Krebs, with the pyruvate breaking into acetyl-CoA, it's also going to produce a lot of CO2 as a byproduct as well. Okay, so that's kind of where lactate comes into play, and that's where CO2 starts to make its play here as well. So we're producing quite a bit of CO2 from the switching of aerobic metabolism, which also produces CO2, but we're also seeing a production of CO2 and anaerobic metabolism as well as the lactate, and that's the big problem here. Now, where do we see the importance of CO2 in sepsis? Well, we just talked about that, where we have basically the cells, the mitochondria itself, are taking lactate, okay, and lactate is now going to end up into the bloodstream. That's what gives us our serum lactate. But we also have CO2, okay, and CO2 is also going to leak into the bloodstream as well. We know that that's how that occurs if you understand the basic physiology. But the problem is that lactate is an acid. Okay, and that lactate is going to create a metabolic acid. Okay, metabolic acid. And that's going to be a big problem. Okay, and so what's happening is that we have an elevated CO2 in the blood. We have a lactate that is also in the blood that's creating your metabolic acidosis. So where does end-tidal CO2 come into play here? Well, what happens during metabolic acidosis? Our body recognizes that we have a metabolic acidosis. And when it recognizes that we have a metabolic acidosis, what it tells the lungs to do is to breathe faster, okay? Increase our respiratory rate. And what that respiratory rate is going to do is it's going to take this CO2 and it's going to try and ventilate as much as we can out in order to decrease or increase the pH level, or a better way of looking at it is to minimize the metabolic acidosis that's going on. We call this respiratory compensation of a metabolic acidosis. And so when we come to a patient that has a fever, they're not feeling well, they have a productive cough, whatever the case may be, they have sick symptoms. They have sepsis-like symptoms. They have 2 or more symptoms on the SIRS protocol. Whatever the case may be, another good indicator with that assessment is using end-tidal CO2 to kind of confirm our findings. And so what we'll do is that we'll put an end-tidal CO2 monitor on these patients. And what we'll typically find is we'll have a decreased CO2, okay, being recognized. And the reason we're going to see a decreased CO2 being recognized is because, one, we have poor perfusion within kind of the movement of blood throughout the lungs because we have a lack of fluid within our vessels. That's the first reason. And the second reason is that our lungs are increasing the respiratory rate so much that we're trying to blow off as much CO2 as we can in order to minimize the impact that lactate is having on the metabolic acidosis. And so if we have a high resp rate, we have a fever, we have a patient that's not feeling well, and then we also have a decreased CO2, those are really good positive findings of a septic patient and correlates to a possible elevating lactate that needs to be taken care of before it gets out of control and this patient needs to end up in an ICU. Thank you so much for checking out this video on end-tidal CO2 and using it for the detection of pre-hospital sepsis. Remember that end-tidal CO2 is only good if you have a good assessment. And so if you're high suspicion of sepsis and you use end-tidal CO2 to confirm that it is low, then we have a pretty good indicator that we're looking at a septic patient that needs to be taken care of with early recognition and early treatment. That being said, there's a lot of evidence that's supporting and also kind of some lack of support when it comes to end-tidal CO2 and its correlation with lactate. So what I encourage you to do is actually check out the article for yourself on the JEMS website. The link is just below, and to get your information from there as well to see what people are talking about when it comes to the correlation between end-tidal CO2 and sepsis and how you can use it in your service in order to do early recognition for your patients. See you next time.